Good evening and welcome to the PharmAssist virtual learning experience. Before we get started, I would like to read this very brief disclaimer that you see on your screen. And that disclaimer is this. The PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of that nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have the disclaimer out of the way, I would like to say thank you again for joining us tonight. My name is Craig Orapello, and I will be your host throughout the program this evening. This is the PharmAssist Virtual Learning Experience, an educational program that was created by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday at 7 p.m. Eastern Standard Time, so thank you for making time tonight to join us. As always, we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A section throughout the program, and that's where you come in. So you can join us via Zoom or Facebook Live. We invite you to be a part of the discussion by sharing your questions in either format. If you're in Zoom, you can share them in the Q&A or into the chat directly. And in Facebook, you can just go ahead and type it right into the chat and we will get to it. So the key thing about this program is that we are joined by these amazing HCPs each week from across the nation to provide you with that real world experience, just as if you were sitting across the table from them in their clinic. So you don't even have to leave your house and you get to have all of this benefit of this knowledge right at your very fingertips. And today we are joined by Karen Hammond. So I want to thank you again for your time and interest this evening. And now I will turn it over to Karen. Take it away, Karen.
Thank you so much, Craig. And thanks to all of you for joining us tonight. And thank you to Mandel's, because Mandel's Clinical Pharmacy has always provided exemplary care for patients who are struggling with fertility issues. And they have put together this phenomenal program so that you can hear from various providers each week to learn about commonly used fertility medications and other things that might help you along the way. So thank you to the folks at Mandel's for all of your continuous support for patients and healthcare providers alike. So tonight I'm going to just go through 3 commonly prescribed products. I'll give you a little introduction about each of them. We'll show you an instructional video, and then I can answer any questions you have. So as you watch the video, think about what questions you have. Feel free to go ahead and type them in either to Zoom or to Facebook, whichever platform you've chosen. And Craig will share those questions to me and we'll try to answer as many of them as we can. So if you have questions or would just like some clarification on something that you may have seen after the video, these are all stored at mymandelsPharmacy.com, as well as on the Mandel's Clinical Pharmacy Facebook page. And just look for the PharmAssist program, and you can watch this video or any excerpts of it as you need to. So I'd like to start out by talking to you about one of the drugs I use very frequently, and that's the Gonolive pen. The Gonolive pen is follicle stimulating hormone. So that's a medication that your provider may prescribe for you that helps to stimulate your follicles to grow. It's one of those few medications that does exactly what it says it's going to do, and it stimulates follicle growth. This medication can be given in various dosages, and you should always follow the advice of your healthcare provider as to exactly what dose that may be best for you. So as Craig cues up the video, I'll just tell you this is a very easy way to give medications using a pen device. Both Gonolive and Follistim utilize a pen device in some of their formulations. It's also kind of interesting to look back, because when I first started in this field about 36 years ago, we had just teeny tiny little glass ampules, and you'd have to snap the top off the ampule after you use a tiny little metal file to create weakness in the glass. So there'd be a place that you could snap it off. And wow, have we come a long way by being able to use these pins now. So Craig, why don't we go ahead and start the Gonolive pin video, and then I'll answer some questions. I'd like to talk with you about how to administer Gonolive using the Red Eject pen. If your prescriber has prescribed the Red Eject pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells you exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles, and it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage, and for today's purposes, we'll say the dose is 150 units. And you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction. Then take the top off of the needle. There's a big cap first. And then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are, or either in the outer part of the thigh. Anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it and you can place it back on the counter until you're ready for your next injection. The Gonolive pen is one of the easier medicines that patients take. And to do this, the only supplies you need are the pen itself, the needles that come in the box, and you also need a sharps container or some kind of hard plastic container so that you can close it up and dispose of it properly. So, Craig, what questions do we have?
Perfect. Okay, so let's get started. We have a couple of questions, but before we get there, again, I just want to remind everyone that you can write any of your questions into the chat on either one of the two programs. You can also do the Q&A directly if you're joining us via Zoom, and we will get to every and all questions that you have for us. And the first one that comes in for you, Karen, is, okay, so if I accidentally give myself too much or too little of the Gonolive, what should I do? Will it be a problem?
You know, you want to always try to be as careful as you can when you look in the dosage window to make sure that you're given the amount of medicine that has been prescribed for you. However, mistakes happen. Sometimes we get a little bit overzealous and may not look quite as carefully as we would hope to, and we can give ourselves too much or too little. If you give yourself too much, don't fret, you can't take it back out. But the next day, give your healthcare provider a call and let them know what you've done. They may want you to take the correct dose the next day and from then on, or they may want to decrease your dosage just a little bit. either way, it's not a problem at all. If, however, you've not given yourself quite enough, then you want to make up the difference and give yourself a second shot. This medicine is fairly forgiving, but you do want to try to adhere to your prescriber's protocol as best you can.
Perfect. Thank you very much. And one of the things we do want to remind everyone, and I know you mentioned it earlier, but part of the way we handle these questions are we want them to be a little bit more general. So they're not something, we will let you know if a question comes in that it's something we would recommend that we send over to your specific HCP at home versus answering in this forum. But we will give our best shot at it and try to make sure that we're pointing you in the right direction. And these are the perfect type of questions on, potential things that you might be nervous about, potential things that may have already gone wrong that you're just trying to follow up on, and everything in between. And the whole goal of this is to make you feel like a pro at the end. So get it all out now. Ask all your questions now. That's what Karen is here for. And Karen will be able to answer those questions for you. And speaking of those questions, we do have, so speaking of the more kind of general all the way to the most specific questions, this one is kind of like a top-down question that just says, what is the Gonolive actually doing during my cycle?
Okay, great question. So what is this medicine for? Gosh, we prescribe so many medications, and I think it's helpful when you do understand what they're doing. So the follicle stimulating hormone is a hormone that your brain normally makes in response to low levels of estrogen. And so when your estrogen level is really low, that means you don't have follicles that are very big. So your brain makes this FSH hormone. And that hormone directly stimulates your ovaries to grow and develop eggs. And your estrogen will get higher, hopefully, in response to the eggs growing. And so that's why we give you a specific dosage. That's our best estimation as to what kind of dosage of this hormone we need to try to stimulate your ovaries and your follicle development as best that we can. That's also why after you've taken this medicine for a few days, you're probably going to be asked to go back to your provider's office to have an ultrasound and maybe some lab work done just to monitor your progress and maybe adjust your dosage.
Perfect. Thank you very much. And like we said, there's going to be questions that are all the way from what do I do with this specific shot as far out as I just want to know what this product's about. And that's what we want this program to be, is to feel very open and ask any types of questions that you may have. And so this question came in that is pretty apropos now that we're obviously in the holiday season, but we are getting into, a lot of places it's been pretty cold. And so this question comes up. That's the flip side of the questions, Karen, you were answering during the summertime about with the heat. Now we have this, and it says, how do I store the pen between shots with now that it's getting much colder? Will that be an issue when I'm traveling? If I get to travel, I assume. Hopefully you're able to travel.
Absolutely. Great question. So if you look on the box, it'll tell you to keep the medication between certain temperatures. And that means that it should stay good to the expiration date. When you receive your box in the mail or from the carrier that's used, FedEx or UPS, when you receive that, then it will be probably on a cold pack and maybe in a cooler. And it says to refrigerate upon arrival. The medications, to keep them good to their expiration date unopened, means that you need to keep them refrigerated. However, once you open it, it's good sitting out on the counter, kind of at room temperature for a good 30 days. So what I tell my patients to do, once they get the medication, just go ahead and put it right in the refrigerator. Each medication will tell you exactly what to do with it, whether or not it needs to be refrigerated. But once you give that first injection, there's no need to stick it back in the fridge. Instead, you can just go ahead and put the pen device in a safe place to keep your any children and pets away from it. Just leave it out on the counter, and it's fine for it to stay at room temperature. I do like to recap it. The pen has a little cap on it, even with a little thing to hook it into your pocket if you want to do that. I can't imagine why, but what I recommend is that you just go ahead and recap it leave it on the counter. And when it's time for your next dosage, go ahead and do the same steps in dialing your dosage, putting on the needle, choosing your site, and administering the injection.
Perfect. And I think one of the things that you mentioned about the idea of opening up your package when you get it, we do a great job at Mandel's making sure that we ship everything out and keep everything, protected for the shipment. And one of the things we highly recommend, to Karen's point, is when you get it. I know some people sometimes feel like, oh, this package, I want to wait till the last minute because I want to kind of roll it out and get it ready to go when I'm about to get my shots. And it's always good to get it out as soon as possible and just get an idea what everything is, what's all the stuff that's in that package, what's in the box, and really know how you need to store different things so you're ready when that time comes. You're not, frantically trying to figure it out. That's one of the key things that we try to do, is make it as simple as possible so you can easily figure that out just by popping that box open. Just treat it like any shipment from Amazon. You're excited to get in there. You might as well dive right in. Don't wait. It's time to go. So perfect. Thank you. And now, speaking of injections, this question came in, and you had mentioned about giving the various different injection shots or sites, I mean. And so this question came in that said, I know that it's good to rotate my injection sites, but what do I do if one of my injection sites becomes more sore than the others?
Great question. And sometimes you may be sore from some of the injections. Generally, the Gonolive and even the Follistim don't tend to make people sore when they take it. It very minimal, if any, usually none, tenderness or local reactions from those medications. If you do have a bruise or a sore spot, that's not a problem. You can go, I think, pretty much anywhere out to the side or beneath your belly button, just wherever you can pinch an itch. I showed in the video that you can also do it in your thigh, in the outside part of your thigh. Again, just pinch an inch to administer it. And some people can even use the back of their arm. And that's not really a hard thing to do. You can just prop your arm up and on a table, for example, or a counter. Just prop your arm up so you can go in the back of the fatty part of your arm. And when you prop your arm up like that, that kind of pinches an inch for you, so you can just put the needle right in. Again, most people don't get sore, but if you do have a little tenderness or a bruise, you can just go beside that area.
Thank you very much. And I know with the holiday season, at least for me, I definitely have no problem pinching an inch now these days. So I don't know. Hopefully that part is getting easier for people. But no, thank you very much for that, because like we said, the whole process you want to be comfortable with by the time you get ready for that shot. And one of the key things is not only are these whole videos, Karen mentioned earlier, available for you on our website, but the individual product videos are as well. And we highly recommend you take a look at those now so that you're comfortable with them later. But then you can also just pull up that video right before the moment of truth, right when you're about to inject that needle, and walk through and get to see Karen explain to you exactly how to do it. So there's no nerves, and you don't feel any discomfort of, oh, I forgot something, or I forgot what the nurse told me about X or Y. That's a perfect way to kind of calm yourself so that you're ready to go at that shot. So perfect. Thank you so much, Karen. And with that being said, we are through all of the questions right now that we currently have. And one thing we always do like to remind everyone, just because if you don't get it in on time for the Gonolive discussion, it's not like once we move on, you don't get a chance to. So we're going to reconsider and talk, get back to any questions that that you may have brought up after the fact. So feel free. But in the meantime, Karen, let's give everyone another 30 seconds or so in case somebody is, trying frantically to type something in on their phone, a quick question. So I'll throw it back to you to give them that 30 seconds or so, just in case.
That's absolutely perfect. Thank you, Craig. So again, there are a number of medications that are FSH or contain FSH, and your prescriber is going to let you know which one he or she feels is most appropriate for you. There are pen devices like the one I just showed you with both Gonolive and with Follistim. There are also some that you mix with Gonolive and with Menopur. We'll go over all these other formulations in subsequent videos. But please use your healthcare provider as a resource, and Mandel's Clinical Pharmacy as a resource. And also you can, as Craig said, you can make these videos like the one tonight almost like a workout video. So when it's time to do your medications, you can just watch the video and prepare yours while one of us providers is showing you how to do it. So you can do it right along with the video. Any other questions?
No, but I get it. I understand because I just said about the pinching an inch is a lot easier during the holidays. So then you reference workout videos. So I get it. It's a subtle hint to take care of. I get it. Okay. I'll step my game up.
Yeah, we're all suffering from those pandemic pounds.
Exactly. Exactly. Well, as of right now, we are all caught up. So we are just about ready. We can move on to the next product. But again, if you think of a question or you didn't get a chance to get it in, we will get back to it. But I will turn it over to you to introduce the next product and we'll get it rolling.
Okay, great. So the next product I wanted to talk to you about is one, I think it's probably the most intimidating of all the injections to patients. And most people are really pleasantly surprised how much easier it is than they ever thought. And that's progesterone in oil, the PIO, as some people refer to it. Progesterone in oil is used to help to stabilize the lining of your uterus, generally after an egg retrieval for IVF, or perhaps even in an ovulation induction cycle where you're just taking medications to stimulate your ovaries, and then maybe you have timed intercourse or an insemination. Obviously, your provider will tell you what medication is best for you. But if progesterone in oil is prescribed, don't be afraid. Don't be afraid. It's a longer needle. It's an intramuscular injection. So we generally tell people to take it in the backside part of their hip, because we don't want it to be in a small muscle like in your arm. You want to put it in a big muscle since it's an oil-based formulation. Let's go ahead and start up the video, and then we'll answer some questions. We usually have lots of questions about this medicine, and we want to really make this easy for you. So Craig, if you'll go ahead and start up the progesterone in oil video. Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just one time. We know you're already clean. Just wipe it one time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. So see, that one wasn't so bad. You can do that with no problem at all. I do have lots of patients that worry about giving these shots because the needle is longer. But remember, you need that longer needle because it's going into the muscle. If you remember back to the last video with the Gonolive pen, I said to bunch up the area where you're going to give it because you want to make sure you give it into fat. But this, you actually want to hold and separate the tissue so that it can go directly into the muscle. You want it to go deep down into the muscle. Since it's an oil-based preparation, it's not absorbed well in fat. You want it absorbed in muscle, and that's a really nice big muscle if you give it in your hip like that. If it does leak into fat, it might cause some little lumps or bumps or even redness or tenderness. If that happens, you just want to avoid that particular site and either go above or below or just to the other side. And whoever's giving your injection, make sure they know that you can tell how much they love you if they put the needle all the way in as far as it'll go. Craig, what questions do we have?
I just mostly love every single time that you say it's only instant death on, on the soap operas. It's still funny to me every single time. So yeah, this one we usually do get quite a bit of questions just because the nature of the injection itself and how it's done and the difference between this one and other ones. So some of this stuff you may have touched on a little bit in what you just explained, but these questions were coming in kind of during the video, so I'll just get them out there to you. So first one says, and we get this all the time, so I'm nervous about giving an intramuscular shot. How do I know if I missed the muscle, and can that be dangerous? What do I need to do?
Great question, and that's a very common question I get too. What I do with my patients, and I bet your provider will do this for you too if they don't already do it, is we will put our hand on our hip and show you exactly where those injections go. But I always draw a target on the hip. I take a Sharpie or a surgical skin pen and I draw parentheses on either side of the hip. Most men are good at hitting targets, except for for sometimes the toilet, but usually if you draw a little target there, and whoever's given your injection knows to go anywhere in that target when given the injection, then they're going to feel a lot more comfortable, and you're going to be a lot less worried knowing if they're putting it in the right place. So like I said, I just draw parentheses on each side of the hips, so you'll know exactly where it should be given. And after a few days, when that starts to wear off, just have a Sharpie nearby so you can redraw those targets on there. Pretty soon, whoever's giving you the injections will go right to the place and not have any problems at all. Once in a while, we do see a little bit of blood leak out. Keep in mind, with any injection, you're going through the skin and through tissue, and our bodies are filled with blood in all of our tissues. So if you have a little blood leak out, that's not a problem. Just put a little pressure there. If you see a little medication leak out, some people say they'll see a couple of drops of the oil leak out. That's not a problem either, because the amount that might leak out is just such a small fraction of the amount of medication that you've been prescribed. And finally, if you put that little bit of air, just a couple of lines worth on the syringe of air in with the medication, that air is going to go in last, and it kind of seals it in the muscle. And I, in my heart of hearts, believe that that causes that keeps people from having reaction, that causes the injections to be much easier and much better tolerated. Another question that I commonly get while Craig is waiting to get some questions is, what if I'm allergic to peanuts? And I said it may be in peanut oil. Any allergies that you have, you want to be sure and tell your provider, as well as tell the pharmacist or your coordinator at Mandel's what you might be allergic to. There are other formulations. It's most commonly sesame oil that it's in. It can be in peanut oil, but it can also be compounded. And Mandel's Clinical Pharmacy is a certified compounding pharmacy where they can mix it up with even oils like olive oil, something that we know that you're less likely to be allergic to, that you've not had problems with before. Another type of formulation is ethyl oleate. That oil is a little bit thinner, but different providers have very strong feelings as to whether they like that as well or not. So ask your healthcare provider, especially if you have allergies, to make sure that they order a formulation that is going to be most suitable for you. Other questions?
Yep, definitely. Okay, so we got a couple coming in, and thank you. You covered a lot. So some of these questions may have a little bit to do with some of the things you just covered there because they came in beforehand, but we'll get through just to make sure that everyone gets a chance to ask. A little bit of what you touched on was the just general kind of issues that could happen with these shots, like the leaking and so forth. But a little bit more specific that somebody said is, what side effects are associated with an intramuscular shot that may be different than your sub-Q shots, and how can I treat after the fact or avoid before the fact them altogether?
Great questions. Again, I think people are just really intimidated seeing that longer needle and think it must be a lot worse. The things you want to look for, especially with progesterone and oil, would be tenderness or redness or local irritation. That's most commonly from the needle not going in all the way, where the medicine is in fat as opposed to in muscle. There are a couple of other things you can do to make sure that the injections are as easy as possible. One of them is to put heat on the area, maybe with a heating pad. We're going to talk about a patch in just a few minutes that you may have the option to order with the rest of your medications from the pharmacy. Personally, I prefer that people not use cold, because you know what happens if you put oil in the refrigerator, it's going to get even thicker. I keep sesame oil in my refrigerator here at home, and I have to let it sit out for a little bit to temper, so I can even get it out of the container. So do the same thing with that. Certainly you don't want to put this medication in the refrigerator. And I would think it would be a little bit more uncomfortable if you ice the area. So if you're going to do anything, just do heat. Whoever is giving your injection needs to make sure they put the needle straight in, all the way in. And the plunger is a little bit harder to press since it is an oil-based medicine and it's a relatively small needle. So they just need to be patient with it. It's interesting, what I found is that most of the time, whoever is giving the injection is much more stressed out about it than who is receiving the injection. Most of the patients, after they take the injection, they're pleasantly surprised how easy it is. And I have lots of patients, probably a quarter of my patients give their own progesterone and oil injections. So if they can do it with the big needle, having somebody with a longer needle, I should say, if they can do it on their own, then for those of us that would have a partner or someone to help them out with it, that's makes it even easier still.
Perfect. And this is all, again, part of the process of getting comfortable beforehand. So by the time you're ready to give that shot, you're not stressed out about it. And that's why all these great ideas that Karen's giving in terms of how to get used to it, how to get comfortable with it, how to prevent in advance any potential issues. These are all things, while you have the time, hang out right now and learn and figure it out. And then you'll be good to go when you have to give that shot. So thank you so much, Karen. That is very helpful. And to your point, we know a lot of people ask probably some of the most amount of questions, the highest volume of questions comes in about this product specifically because either people hear things about it or they Google things. And we always recommend don't use Dr. Google, but come in here and ask those questions. But hopefully we're putting some of that stuff to rest and putting you at ease. So speaking of this question, in terms of people being a little bit nervous and want to get this stuff out of the way. So it says, what happens if I miss a shot of my progesterone and oil?
Great question. So you wonder, you think, how can I possibly miss an injection? You've been prescribed these medicines. You're probably going through some time-consuming intensive fertility treatments when you're prescribed these medications. We're all human. We all forget things. Time gets away with us. Some of the things that I do to try to keep people in the habit of taking their medicines, as I say, pick a time and stick with it. Sometimes your provider will say, take your medications at this time or around this time. Whatever time it is, pick it and kind of stick with it and incorporate that into your usual routine. So hopefully you won't forget it. If you do, what I would tell my patients is don't beat yourself up over it. Instead, when you remember it, go ahead and take it. If you're supposed to take it at night and you don't realize it until lunchtime the next day, then I'd probably say call your provider and ask what they recommend. I would probably just say forego that dosage and just take the next one at the right time. When we give these medicines, it's kind of a fine line in making sure you have the perfect amount without having too much or too little. But nevertheless, they're still forgiving. So if you're running a few hours late, that's not a problem. If it goes into 12 or 20 hours, then just check in with your provider. We're always happy to answer any questions that you have about your medicines. We don't want you to fret about this. I have had some people forget to take it for a few days, and they still do just fine. I certainly don't recommend that. We want everything to be as perfect as we can, but we're all human and these kind of things happen. I've also had somebody decide she was going to take it twice a day. The only big drawback to that was her hips didn't really appreciate it taking it 2 times a day. She was having to pretty much give a shot in both sides of her hip every day. So some providers may recommend that for specific patients, but just try to do your best to try to pick a time, stick with it, and incorporate that into your routine.
And we do actually mention quite a bit on these, on the PharmAssist programs, that one of the things is we live in an age now where we have a million different things that can have a reminder for us, like whether it's your phone or your watch or you have a little speaker sitting next to every desk in every room in your house or something like that, depending on how much you like that kind of stuff, that you can just say, give me a reminder at such and such time every single day. And that's a perfect way to always just remind yourself, just have it pop up on your phone right away. And then that you'll have a better chance of remembering than just trying to, utilize just the brain for memory, which I can't do anymore. I definitely have to rely on all of the technology in my house to remind me of things. So thank you so much for that, Karen. It really does put, I think, a lot of people at ease, understanding, worst case scenarios, best case scenarios, and then where we're all going to live is somewhere in the middle. So great. And with that being said, we are all caught up with questions. So what I'm going to do is I will, as always, I'll throw it back to you. Let's give another like 30 seconds or so for everybody to get any questions they may have. Again, remember, you can ask them at the end, but if you have anything, now's the time to ask before we move on to the next product. So back to you, Karen.
Perfect. All righty. Thank you. So if you've been prescribed a progesterone and oil, don't fret over it. There are lots of resources for you. Certainly your provider, these videos with the PharmAssist program, the folks at Mandel's Clinical Pharmacy. It's kind of interesting to me. I take care of a unique group of patients that have started up their own Facebook support group for the treatment that I offer. And it's fun to, they've invited me to participate in this group. And I tell them I won't read it unless they tag me on something. And this particular IVF series that I'm in right now, I've had a lot of people administer their own progesterone and oil injections and tag me on the post and ask me if they did it right. So there are lots of ways to communicate with your provider and with the pharmacy. So take advantage of all of those things and have faith in yourself. You can do this. Other people have done it before you. Other people will do it after you. I tell people after they do their first injection, they'll be the one out in the waiting room telling folks how easy it is. You'll be pleasantly disappointed that it goes so much better than you'll think. So if there are no other questions, then I'd like to introduce to you the third and final medication that I'm going to talk to you about, and that is the Sonara Patch. I don't know if you've all heard about this medication or not, but it's really kind of a cool thing. It looks like a really big Band-Aid, and you open it up and apply it to where you're going to inject your progesterone. It's kind of cool. It numbs up that area and it warms it up to make the injection essentially painless. So Craig, if you'd go ahead and start up the video, then we'll answer some questions on the other side. I'd like to talk to you about applying the Sonara Patch. This patch may have been prescribed to you or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side, directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later. Perfect. So this is a cool little thing, this little patch. I've got one right here beside me. Sometimes insurance companies cover it. Sometimes they don't. Generally, that's a deciding factor whether or not to order them. But ask your provider as well as the pharmacy if this has been ordered for you or if this is something that can be ordered for you. Probably half of my patients use these. And it's, again, it's a lot like a Band-Aid. On one side, it's got like a little tab so you can just lift it back and remove it from the plastic covering. What I will usually tell people to do is just to move it halfway and then apply it to the skin, and then just pull it the rest of the way off. Now, if you look at the inside of it, the part that's going to go near your skin, there's like a little foil area around it and a white part in the middle. That the medication is actually in the white part in the middle. I've had some patients do some interesting things just to try to be as efficient as they can and to maybe save money or cut corners. Had people try to cut these in half. Don't do that. That just ruins the whole thing, and it will not be effective. But what you can do when you do apply it, just make sure that you do it about 30 minutes, 20 to 30 minutes before your injection, and that'll give that numbing component and the heating component time to take effect, and you won't even notice it at all, the needle going in. A lot of my patients who give their own injections use the Sonara patch just to make it more comfortable, and it boosts their confidence as well. So Craig, tell me what questions you have.
All right. Yeah. So the first one is just, I guess, more of a general, you touched on a little bit, but a general idea, just how it works. So it just says, how does the Sonara patch actually work to help with the pain? What is it doing?
Right. Yeah. So it if you look at the package, it'll say exactly what's in there, and it's something that warms as well as a couple of numbing medicines. One of them is lidocaine. You probably know that from going to the dentist, but it just numbs the outer part of the skin. Most injections, what you really feel is the needle going through the skin, and you may feel the medicine when it goes in. And so what this does is it heats it up and numbs it. Remember how I said that you might want to put a heating pad on your hip before these medicines, but not ice. So that's kind of holding true with using these Sonara patches.
Perfect. Thank you so much. It's always good to know how everything works as well as what you need to do to make it work. So you kind of feel the process out once you have a better understanding of what everything is doing. So this you did touch on a little bit when you mentioned the 30 minutes before. Is that, I know that's the time that is indicated is you put it on 30 minutes before to get the full impact of the treatment. But a question came in, and this has come in a couple times before, is it possible to actually overdose with the Sonara patch if I leave it on too long? Should I be nervous or worried? Should I be running a clock?
Great question. And nobody's ever asked that before, so I really like it. My thought is you put it on for 30 minutes, that's when you're going to get the maximum effect. So leaving it on for longer, it's not going to be any more of an effect. So I would say with all medicines, you want to use the least lowest dosage and the most effective. So doesn't do any good to leave it on there for any longer. And you can't reuse these. So if you take it off at 20 minutes and you hurry and you put it back on the plastic backing and hope you can reuse it tomorrow, it will already kind of be spent once you take it from that plastic backing. So don't cut them in half. Don't try to reuse them. Just put it on 20 to 30 minutes beforehand. That's going to give you the maximum effect. And then give yourself the injection.
Perfect. And one thing just to toss out there, and this is just it's just some added information to that. I do know that as part of the test, if people are worried about leaving it on too long or something like that, as part of the test, they had done tests all the way up to 4 patches, leaving them on for an hour, which would be obviously exponentially more than what you would be doing even with the half hour or a little, if you've left it on a little bit longer, and it wasn't even close to any level of what overdosing or toxicity or something as the question asked. So
Right.
just be comfortable knowing that they did everything they needed to do to make sure that you can leave it on and be safe, and just as everything else, like we said before, just set a timer for yourself if you need to, but you will be safe using the Sonara patch. Is definitely safe. So great. Sounds good. And then one thing too that came in, and this came up a couple different ways people asked it, but the easiest way is what happens if I cover it up with my clothes? Will it not work?
No, that's not going to matter at all because it's kind of like a Band-Aid. A Band-Aid. The backing to it is actually looks exactly like a Band-Aid. That brand, it's even that funky color. So your clothes are going to be fine. It's not going to melt through or absorb. I wouldn't worry about that at all. You don't have to go around streaking while you've got the patch on. It's just right before you give your progesterone injection, then you want to just take the bandage off. I tell people just to put it back on the backing and toss it, just because it is really sticky, and then wipe the area with alcohol and administer the injection, just like the steps I showed you before. People have also asked me about, well, gosh, if it's so good for the progesterone, how much greater could it be if I use it with other medications? There's no harm in using it with some of your subcutaneous injections, but gosh, those are so easy anyway. I really don't think I don't think that's very cost effective. I think you'll find that that you'd rather have the money that the patch costs than to use it for those small sub-Q injections.
Definitely. Sounds good. Thank you. And I do know part of the, like when it says, quote unquote, let it breathe, is really just means don't, to Karen's point, like you obviously don't want to wrap it up in a, like in a, you know, in an athletic tape or something like that, because you do want it to breathe, to let it heat up. And that's what part of what activates the product itself, is that kind of heating up process. But yes, putting like clothes over it, of course, yes, you do not need to say like, well, now I can't wear anything for, I can't have anything covering my arm for the next hour. That's not like that. It's just, you just want it to be able to breathe just like normal clothes. So that's awesome. Thank you so much for all of that. Sonara, is it usually, as always, there's a couple of big questions everyone asks, but there's not a lot of course, because it's a patch. It's easy. People get it.
Right.
So we are pretty much through most of the questions for Sonara, or through all the questions so far, unless anything else comes in. So if you want, we can give another 20 or 30 seconds. At this point, we can really open it up to everything. If there's any questions about any one of the three products, the Gonolive pen, the progesterone and oil, and the Sonara, if you have questions about any one of those three, or just something in general, this is your time to ask it. But in the meantime, I'll throw it back over to you, Karen, if there's anything you want to share with everybody as we get prepared to start wrapping up tonight.
Perfect. So I did want to just tell you a couple of other things about the Sonara patch. This was actually developed to be used on children when they were having IVs started, just to try to make it as painless as possible. I'm sure many of you know that sometimes if a nurse anesthetist starts an IV, he or she may numb it up with just a little local injection. Well, that kind of stings a little bit. And for children, they certainly are needle phobic, especially sick children that have gotten lots of injections. So they came up with this patch just to kind of numb up that area. So while we primarily write these prescriptions for the patches for patients taking their progesterone injections, some patients are really needle phobic and they hate the thought of doing needles anywhere. So this is a nice little tool to use as well, that you can put on your arm where blood's going to be drawn, and you can put it on there for 20 to 30 minutes before the injection, and that'll make your blood draws where you can't even feel them too. So talk to your provider if you're really worried about it, and maybe you can use a Sonara patch for blood draws if you're particularly intimidated by needles, or if you've been told that you have bad veins and you think they may have to struggle a little bit to get your blood. That may make it easier for everybody. The pharmacy is really good to check to see what kind of insurance benefits you have, whether or not insurance will cover it. If it doesn't, these patches are about $10 a piece. So that can help you in making the decision if that's a medication that you want to order for your protocol or not. So tonight we have talked about 3 different medicines: the Gonolive RediJect pen, we talked about the progesterone and oil, and we talked about the easiest of them all, the Sonara patch. I hope I've been able to answer some questions for you and to make this process easier for you. All of us, your providers, the pharmacy, myself included, we all just want to make this process that you never thought you would have to go through. We want to make this as easy for you as we possibly can, and show you that the medications that you've been prescribed can be really easy to do as well. Again, you've got some great resources with your provider This video will, as well as others, are on the mymandels.com website under the PharmAssist tab. It comes up right on the front page of the My Mandels Pharmacy website, or you can go to the Facebook page for Mandels Clinical Pharmacy, and you can find these and other videos as well. You can use it as a refresher. You can use it if you've got somebody that's going to help you with your injections that can take a look at it, or you can use it, like I said, as your workout video and prepare your medications for injection right along with us as we show you how to do them. So Craig, I'm going to turn it over to you one more time to wish everybody well. I won't personally be seeing y'all back until the first of the year. So I want to wish you all very happy, healthy, and safe holidays. Thank you.
Thank you so much, Karen. We really, really, really appreciated everything that you've done throughout this program and everything tonight, as well as the larger the PharmAssist program. So I really want to say thank you for that. Even though, again, you did bring out the workout, you brought up the workout video thing again. So I know you're really just trying to drive home. And I guess it's a rough look right now in the screen. Thank you so much for everything. I do want to say, all of your expertise has been so helpful throughout this program tonight and throughout the wider PharmAssist program, and really helping not just us at Mandels, but all those people at home, all the patients, or anyone else that's logging in and looking for some answers to some questions. We're glad that we're able to be there for you. I definitely want to say thank you to everybody who joined us tonight, whether you were on Zoom or Facebook Live. All of the questions were excellent, and we really hope that everyone was able to learn something. That's really our goal, is to make sure that you feel confident and you are a professional and ready to go by the time you're given that shot. And hopefully this gets you one step closer to that. Just to reiterate, I know, Karen, you mentioned it, but we want everyone to remember that you can find all the full virtual learning experience videos, or VLEs as we call them, as well as the individual product videos. You can find all of them on demand on our YouTube page, our Facebook page, and as you mentioned, on our homepage, mymandelspharmacy.com/pharmassist. Everything goes up there right away, so you can watch the whole thing again with all the Q&A, or just the individual videos that Karen and our other great nurses walking you through. We definitely look forward to seeing everyone here again next Monday night at 7 p.m. We're going to have another great program with some different products and some great conversation. But the number one thing that we have learned in the age of the internet, the best way to get the word out there about this program is to share whenever you can. I'm sure you know a friend or a family member or even a colleague or somebody that's a friend of a friend who might be going through something like this, and they don't yet know about the program and they're struggling to find a place to get the answers that they're looking for. Please share it with them. Let them know. That's what we're here for. We want to be able to answer those questions and make them feel just as confident as you do. So thank you again so much, Karen. I look forward to seeing you again in the new year for the next program, but we will see all of you at home next Monday night, and happy holidays. And we'll see you again. Thanks for joining us on the PharmAssist program again tonight. Have a good night, everybody.
Good night, everyone.